We guarantee that when we provide personal care in someone's home, right, we serve as the eyes and ears of family members who live out of state. And why is that? Because of the philosophy of our company. We are a social work model-driven company, so we understand that today's problem or yesterday's concern change very frequently.
We always thought that we were a surrogate son or daughter. What we really realized is that we were a surrogate brother or sister. Is that we're really the eyes and the ears for the sons and daughters.
Most people who need home care, the home care they understand is getting somebody to help my mom take a shower, get dressed, go to the doctor, provide errands. Right? That is the home care that most people in the United States are accustomed to knowing as a layperson. And that is what Boca Home Care Services has been doing since 1998.
So in 2005, we opened Boca Home Care. Boca Home Care provides the nursing and the skilled service set. So that would be nursing, physical therapy, occupational therapy, speech therapy, and a medical social worker.
Those services are covered by Medicare at 100%. If you're entitled to Medicare because you're either 65 years of age or older, or you've been disabled for at least 2 years, you are entitled to Medicare.
So under this orbit of care, we have the patient, we have the private duty division, we have the Medicare division that helps with the floor to low vision and the lymphedema patients. We have this guardianship that helps patients.
We basically act as the eyes and the ears of the physician out there so that, number one, a patient can remain at home, and number two, if there's any initial sign of a problem or a decline, we can catch it before it becomes a full-blown problem.
We are liaisons between the client and the caregiver to create a really great plan for the client. Often clients think that they can't afford care, and we really try to sit down, speak to the client, find out if they have any entitlements, perhaps veterans benefits, if they have a supplemental insurance. Sometimes there is a benefit in their supplemental insurance to pay for care. So we specialize in finding entitlements for patients, and we like to find entitlements that they can get reimbursed for care.
Low vision patients, they're not blind and they don't see fully well. They have low vision. So a lot of the retina doctors will refer patients to us when they really can't help them anymore. And sometimes they may have depression, and because they are just becoming low vision, they're not going to go blind. But what we're able to do is help the occupational therapist helps the patient train their eyes how to see without always only looking straight. They have they train the muscles to still be able to see, and it's a tremendous help for them. We help with that continuum of care. We're making sure from the time that an episode has happened to the time of discharge that we are following the plan of care of what the physician wants. And we have coordinated efforts with all of the local facilities. We've been around for 15 years. They know us, we know them. And we help patients in all of those different settings as well. So they could be helped in the hospital, in the rehab center, or in their home and residence, which could still be an ALF, assisted living facility, an independent living facility, or at home. Whatever they would call home, we would help them.
What makes us different than every other home care agency in the state is that we also carry 4 employed social workers to deal with issues of grief and loss, entitlements and benefits, whether they're in-kind benefits like Medicaid or entitled benefits as in Medicare. We're able to facilitate that process. Both companies have the philosophy that we're going to do whatever it takes within reason, within appropriate physician's orders and long-term care insurance orders to maximize a person's independence within their home environment. That is our motto.
I live in Island Beach, and you have sent me a wonderful aide who's with me. As a result, I can live independently. I don't have to go to assisted living or a home. So I'm very satisfied with the services that you've provided.